Hyperlipidemia, commonly referred to as steatosis or dyslipidemia, is a disorder when the blood's index of fat exceeds the level due to factors that result in metabolic dysfunction in the blood's lipids. The blood typically contains a specific amount of fat. Triglyceride and cholesterol test indicators are used to determine this rate. These indexes will be higher than the permitted amount if you have fatty blood. One sign of dyslipidemia is elevated cholesterol, one of the most prevalent disorders today in fatty food, obesity and obsessive blood fat, which are primarily thought on by an inappropriate diet, excess drugs and insufficient activity. I'm Robert, an American professor from the Lawrence Berkeley National Institute. I get a lot of situations involving blood fat every day. Others experience chest pain, heart palpitations, and breathing difficulties, while others only get headache and dizzy symptoms. Patients frequently find it challenging to diagnose fatty blood since it frequently lacks evident signs. Many times, people are first diagnosed with fatty blood after the disease had advanced to a severe degree or after receiving normal medical exams. In comparison to high cholesterol, elderly, hyperlipidemia in young people is frequently a more subtle and more challenging to diagnose. If the illness progresses to an advanced level, it will result in possibly life-threatening symptoms like high blood pressure, heart attacks, atherosclerosis, pancreatitis, and cerebrovascular accidents, and even death. One of the leading causes of death in the USA is related to hyperlipidemia. If dyslipidemia or hyperlipidemia is not treated in a timely manner, it can lead to numerous harmful health issues. Early detection of fatty blood allows the patient to convert to a scientific diet and engage in regular exercise to lower the level of circulating fat. The disease will reach a stage at which point the therapy will be significantly harder and more challenging. Additionally, dyslipidemia is readily recurrent if not adequately and permanently treated. Because I have always been particularly interested in this product, I constantly recommend that those patients who take CO B12 complex after each thorough examination. No side effects, quick and efficient. According to the data, more than 93 million people in the US who are 20 years of age and older have blood lipid levels that are higher than the recommended limit of 200 milligrams per deciliter. This illness costs a lot of money in treatment and lost labor each year, leading to more than 1 million hospital admissions, 50 million visits and other complications. People like us who work in research and therapy always bear in mind that we will find a solution to assist people who are suffering from blood fat illnesses and the disease that they have experienced in order to be able to lower this quantity. After rigorous study and testing, CO B12 complex was created, and due to its excellent therapeutic impact, it has always been suitable for use. It has been demonstrated by the US FDA to prevent cholesterol from being absorbed from the digestive tract. When patients use this medicine, there is a clear improvement in blood fat pathology starting at 14 days. Additionally, CO-B12 complex has the ideal combination formula which dramatically increases the levels of choline and inositol and other important nutrients in the blood, boosting the immune system, managing weight, fully repairing any harmful cells in the body, and you can stop dangerous complications from fat blood, including cardiovascular stroke and high blood pressure. While it may take several months with other treatment products, I guarantee first and foremost that CO-B12 complex, your body will notice a significant improvement within just 1 month. The benefit of CO-B12 complex is that it is 100% free from side effects, completely safe from the body, and may be used for a very long period. The second point, it has the capacity to regulate blood lipid levels and stop illness consequences. The third is the capacity to substitute daily necessities and augment high cholesterol sufferers with specialized nutrition, which contributes to their overall health improvement. I've recently talked to and offered advice to a lot of patients on CO-B12 complex blood fat supplements. In actuality, a lot of people used it and had great results. After just a few weeks of use, they have already noticed a big difference. Blood pressure and blood fat indicators are now more stable. The patient feels overjoyed that his or her body is healthy and that things have returned to normal. Being an educated patient and a wise customer is important because a product's influence can only be realized when you are the one using it. As a physician who has assisted numerous patients in reducing blood cholesterol levels, and as a physician with extensive knowledge in the fields of research and development, I advise everyone to put their faith in this product and try CO-B12 complex. Are you ready to have a healthy life with CO-B12 complex? The choice is in your hands.